Hi, everyone. We're live with Jean-Luc Neptune and Adam Banks, the co-founders of Suntra Modern Recovery. Hi, JL and Adam. Thank you for joining us today.
Hi, Ashley.
Ashley, thank you.
Of course. So we're excited to learn more about you and your backgrounds, and I'm looking forward to also learning more about Suntra Modern Recovery and how you're simplifying the journey of recovery for people with substance use disorders. So thank you again for making time to chat with us today. And for those who are joining live, please feel free to submit any questions that you have for JL and Adam in the Ask a Question box that's at the bottom of your screen. And with that, let's get this conversation started. Okay, so JL and Adam, I know before we dive in, I know that we've been sheltering in place on the East Coast for some time now. Adam, I know you're not in the city right now. JL, you are. But what's the first restaurant, or if not restaurant, what's the first place that you'd like to visit once this sheltering in place and quarantine time is over and it's safe to go back out again?
Oh, boy. I can lead. I would just like to have a nice sushi dinner in a restaurant. That's what I think that's the first thing I'd like to do. Just go in a restaurant, sit down, and enjoy a meal around other people. I think that's the first thing I'd like to do.
I love it.
And the thing that I long for most right now is a barber shop. My partner cut my hair just for this interview last night, so I'm looking forward to getting it done professionally.
I feel you on that. I miss hair salons and all those things we took for granted before this moment.
And actually, I'm actually on my third self-cut so far.
Do you think are you eager to go back to spending money on a barber, or are you content with your new skills?
Well, I have a simple cut, but you really understand what a professional barber does when you see how badly your haircut looks when it starts to grow out. That's when you really realize somebody has professional skills.
All very true. All right. Well, I'm happy to dive into this conversation with you both. So I guess to get us started, can you share a bit about your backgrounds and what led you to doing work in addiction recovery?
Sure, I'll lead. So, I'm a physician by training, trained in the Columbia system here in New York, but always realized I was interested in the broader story in healthcare, particularly around technology and delivery. So I got an MBA after I finished my residency, and for the last 20 years have been working in startups, either of my own founding or startups that I've joined, to marry technology with healthcare. And, going back to my residency years, observed that addiction, substance use disorders are a big problem, right? From a clinical standpoint, but also from an economic standpoint. And there's probably no bigger problem in healthcare now than addiction and sort of the unmet needs in addiction. So that's my background. I sort of more recently get pulled into it by meeting Adam back in 2016. And, we've been working together since then.
Nice. Awesome. Thank you for that.
And I think true to any sort of addiction medicine practice, there's somebody that's been involved with addiction, and I've been through a significant addiction in my life. I used to be an airline pilot, and after 9/11, I was no longer flying, and pilots just weren't working at that time. Lots of parallels to what's happening in the airline industry today. That turned into a significant addiction in the years post 9/11. Got sober. This is 15 years ago or so. Started in healthcare. My partner at the time was a physician, and we started a small company, direct to consumer physical therapy and sports medicine. And this is how I became an expert in managing private practices, physician practices. We grew that company relatively large and sold it to United Healthcare. And then truly I have a passion about addiction, and have had my own struggles, and think that there's better ways to treat addiction.
Thank you both. Thank you for sharing your story, Adam. And so you kind of touched on the second question that I had, is like the story or the why behind Suntra Modern Recovery. I don't know if you have anything else to add to it, but I think you both kind of gave some context as you shared your backgrounds.
Sure, and we can elaborate further. I mean, I think the opportunity that we saw, and as Adam and I worked together thinking about, the opportunity that we wanted to pursue in addiction is that, the dominant model in addiction is around 28 days of residential or inpatient care. And that's been the model for probably 70 years or so, maybe more. And, the issue that we've observed, and sort of Adam has, observed as well, is 28-day therapy doesn't work for most people. The vast majority of people will have a recurrence, will end up going back to therapy or to 28-day rehab. And, it's just not an effective clinical treatment for most people. And some people can't afford to go to 28-day rehab. They can't leave their jobs. They can't leave their families. So, what we've really focused on is trying to figure out, how do you develop a clinically effective model that engages people in the way they want to be engaged and helps them achieve better clinical outcomes, in the context of their work and their family and the other responsibilities that they have.
Awesome. All right, what, still getting in more into both of you personally, before you get into the details of the business model, what's one thing you've learned about yourself since becoming founders?
This is interesting for me because I'm easily distracted, and I've got fear of missing out, and I've got jealousy whenever I see another company that raises money. I immediately go to JL and I say, look at these guys. They raised 5 million, 10 million, 100 million, whatever their success is. I'm like a pointer dog, and I look at that and I say, geez, we've got to do what they're doing. And JL is incredibly good at kind of keeping me in check and holding the course. And I think that's important. It's I would be distracted and like a ping pong ball as we grow the company, and JL is he's definitely got that physician mentality of process and really following a process.
Yeah, I mean, for me, I've as you know, Ashley, I worked at Blueprint Health before, invested in, lots and lots of early stage startups, and, realized working with those startups that this is hard, right? Trying to innovate, trying to break up traditional models is really difficult. And, once you're in it yourself, and we've been at this for 6 months now, it's hard. But I think what I've learned is that I'm resilient. I think some of that resiliency comes from, the daily torture of residency. You built some resiliency there. And, I was a college athlete as well. So I'm going to develop some resiliency doing that. So I'd say that especially in the COVID era, and as you know, I was sick for a month with COVID symptoms. I realized that I'm very resilient.
Awesome. And resilience is definitely something that's needed while building a company, especially during these times.
Yeah.
Which again leads into my next question. How has COVID impacted the way that you've been thinking about Suntra and entrepreneurship generally? And how has it impacted the way that you're thinking about your model and just being an entrepreneur during this pandemic and economic climate?
I can lead. I mean, I think, when we first launched, being virtual focused and, being focused on providing care outside of a residential space or a real estate location, that was pretty innovative, right? There weren't a lot of people thinking about virtual rehabilitation. There weren't, not anybody was talking about a virtual IOP, intensive outpatient program. So, I'd say that the pandemic has really blown open the realization that you can use virtual care to treat a lot of different conditions, including addiction, right? People with substance use disorder. So I think that's been very helpful. I think that's opened the market and raised awareness. I think, and Adam can elaborate on this as well, the pandemic, I think, has made it much harder for people who are dealing with substance use disorders. You can't go to an AA meeting. You can't see your doctor because your doctor's office is closed. So I think some of the interpersonal stuff has made it harder. But again, that creates an opportunity for us and an opportunity to help people.
Awesome.
And I think it's we're just starting to see how the consumer is going to respond. I think we started our company at the exact wrong time. We were sort of launching our marketing campaign probably a month before COVID. And then JL got sick with COVID right as the beginning of the probably back in mid-April. So trying to think of how to market to people that were certainly worried about other things. We ended up sort of hibernating marketing and just waiting a month or two. And I think we're just now to the point where we're going to figure out how customers are going to behave and how to actually market to customers in a new world, where 3 weeks ago or 4 weeks ago, we certainly didn't know how the consumer was going to respond. Certainly people are having significant problems in addiction. Anybody that's working in addiction right now, we know people are at home. It's no secret the quarantini and people are drinking more. When they start seeking help and how they're going to start seeking help, we're just starting to see that right now.
Awesome. Thanks for sharing all that. All right, so I want to learn a bit more about the details of the business behind our business model of Suntra. So can you break down the business model, like who are the customers and the size of the market opportunity?
Sure, and maybe we can back up a little bit and just talk about product first.
Okay, yeah.
So what we offer, again, is what maybe the term of art these days would be a virtual IOP, right? So there's this notion that there right now, prior to the pandemic, there were intensive outpatient programs, IOP, which is a way to treat somebody in the community instead of having them go to rehab, often used, in complement with traditional 28-day rehabs, sometimes used as an alternative depending on the nature of the patient. So really what we do is we focus on providing an IOP type experience using virtual technology. So, using telemedicine, taking care of patients at home. And then I think one thing that we do that is really builds on our strengths is the focus of planning and management and care coordination. I think there are a lot of people out there who are providing addiction treatment, but it's a very fragmented experience for the patient. The patient sees this person to have an intervention, then sees this person for their medication, then sees somebody else as a coach. And, patients can often get dropped in that process. So what we're very much focused on is the care coordination piece and using technology to tie that all together. In many ways, I think about this as almost like a logistics business, right? We're getting doctors, nurse practitioners, PAs, coaches, therapists to the patient where they need it, at what time they need it, and in which way they need it. And sometimes that's going to be a video visit. Sometimes that's going to be a phone call. Sometimes that's going to be a text. And it takes a lot of knowledge and pattern recognition to understand, what do you utilize at what time. So that's really the product. That's what we focus on. And, what we sell is a subscription-based product that ranges depending on, whether you are getting just medication from us, so we'll give people medication, access to a physician, access to a coach, all the way to an intervention service where, we can help people who are at the point where they realize that they need care, get that care. And then after somebody is stabilized, provide them with ongoing coaching and support in that way. So that's our product. We do that on a subscription basis.
Awesome. Thank you for breaking that down. And so how are you currently acquiring customers?
Customers, and we can go back to business model when you're ready. But we think that the best way to address customers in this environment is really talking directly to people. And the way we do that is we do that through content management, through social media, through digital advertising. But we're really trying to go directly to patients. I think that in this business, you could align yourself with established stakeholders, but I think that, the established stakeholders, the established rehabs, the established care providers, they're very much invested in either a fee-for-service kind of model. So again, I talked about, we have a subscription model, and then many of them are very invested in an in-person kind of model. If you have a very expensive rehab location, you need people to come there, and our focus is trying to keep people out of that. So, we're not necessarily aligned with a lot of the legacy stakeholders, and we're focused on reaching directly out to patients, many of whom who are not being served well now, who, for whom inpatient rehab hasn't worked, or we think there's an even larger opportunity, a larger community of people that we can help who are not being treated at all because they just don't have the time to go to rehab.
Got it. Okay, so can you speak to some of the models that maybe, could be seen as competitors or people who are doing similar work, and how Suntra is providing services that differentiates yourself in the market?
Yeah, I mean, I alluded to it before, but I think there is a legacy market, a legacy group of competitors, and well-known names in rehabilitation, drug and alcohol rehabilitation. Most of those folks operate a business that has a physical location that patients go to, spend a period of time there, and I think some of those guys are trying to move to a virtual model, but I think they hope to get back to their physical model. I don't want to speak for them, but I think that's the case. And then there's a whole bunch of new players who are trying to be, who are focused on internet first. And a model that you typically see is, maybe a visit with a doctor, some medication, and some coaching, and there are a number of players there. I think that a lot of those players are focused on substance. I think a lot of them are focused on, substance and helping patients stop taking or take less of substance X, whether it's alcohol or opiates or whatever. But again, I think what I'm doing and what's really different is we're focused on the care coordination piece and understanding that people exist within a broader network of issues other than their substance, and that there's family issues that they need to manage, there are work issues that they need to manage, and they often need help in managing those issues.
Right, and that kind of transitions right into the next question that I was getting ready to tee up. So I know that Suntra is offering personalized care for substance use disorders. So can you share why this personalized approach is critical to recovery?
Okay. I've been talking a lot, so I'll defer to Adam on this one.
Well, it's you're talking about other business models, and there's some apps that are coming out that are trying to be very low touch, really kind of a AI focused, treat addiction through text messaging. And then there's the very high touch 28-day rehab programs. And we're trying to be in between there. Some of it we want to automate, some of it that we can automate, we will. With addiction though, certainly there does have to be interaction. It's never going to go all AI. Texting somebody during the throes of addiction is certainly not enough. People do need a intense level of care, typically in the beginning, and then it tapers off. So how can we create that? How can we scale that intensity and do it affordably? Addiction is very isolating. Whenever people get kind of an advanced addiction, it's very lonely. It's typically a home alone in a bedroom or home alone someplace. And we know that to cure addiction, the opposite of that is human connection. AA meetings have proven this since the 1930s. Going into a room and recovering together is very, very important. And that human interaction of being in it together is important. So there is an intensity that does have to be delivered, and at what points people are ready for that intensity and can have time for that intensity and being ready to deliver that to them.
Right. Thank you for that, Adam. And so how does drug and alcohol detoxification work at home? Drug and alcohol detoxification work, and what are the benefits to the patients? Like, I know you kind of alluded to cost being a barrier for some people, and having to take time to be away can be another barrier. So how does it work, and what are the potential benefits for patients?
You want me to take it, Adam?
Well, it's I want the doctor to answer that, but it varies so much. It certainly varies on what drug you're doing, the quantity of drug you're doing. Some drugs you can be doing a lot of it and you really don't need any sort of medical detox. Crystal meth I'm thinking of. Alcohol, you can have it's sort of the most common drug, but it's the most critical drug to detox from. But it certainly depends on the quantity that somebody is drinking. A whole lot of people don't need detox. They can sort of go in a cold turkey kind of way. But when it is serious, it is very serious, and I'll key up the doctor for determining when that comes into place.
Right. And you know, and I think that the key is cost is one issue. You know, comfort for the patient, being in maybe a more comfortable environment around people and places that they know, I think is useful. I think having, you know, patients receiving care in the context in which they live is really important. You know, a lot of times patients will go away to a foreign environment, they'll get better for 28 days, and then they come back and they're exposed to the same triggers and stressors. So I think it's, you know, providing great care is treating patients in the environment in which they live, you know, and then, you know, the other important piece is discretion. For many people that we serve and that we work with, you know, if they go away for a period of time, you know, their lives are permanently impaired. You know, if you're, you know, a busy professional, if you're, you know, tied to the financial markets, if you're in a professional services business, if you have to leave, that can really, you know, impact your career, maybe even end your career. So I think a lot of people need to get treatment, whether it's detox or rehab, in a discrete environment, and often being able to do that within the context of being home allows you to, you know, maintain people's privacy, their confidentiality, and that can help somebody get back on their feet, get back to where they want to be. And the people around them, other than their very close contacts, don't even know that they may have had a problem and may have gone through a detox.
Awesome. You literally answered the next question I was going to have about privacy and how Suntra is ensuring the privacy of patients, the patients that you serve. So you spoke a bit about the experience for the patients and that being a factor in how you're maintaining their privacy and discretion. But what about the technology? Are there any risks there, and how do you foresee kind of protecting against?
Yeah, I mean, you know, I think obviously we're doing all the table stake stuff that anybody else is doing, you know, using the most advanced HIPAA compliant technology, training our staff, having the right procedures. I mean, you know, when you have many privacy breaches are around those two things, right? Either you're using a technology for your EMR or for your communications that somehow lets information out about a patient that you would want. You know, Adam and I have done a bunch of consulting as well. And, you know, we've been to clinics where, you know, somebody is yelling the patient's name from one side of the clinic to the other. So, you know, it takes training to get people to understand that. So, you know, I think we consider that table stakes. If you're not doing that, you're not doing it well at all. But, you know, we think that the places where you really help to maintain privacy and support or allow discrete care is one, again, you know, treating people at home. Another really important tool that we've seen a lot of tech guys, right, who are working for startups. You know, they are chained to their desk. They show up maybe, you know, 9 o'clock or so, and they're there till midnight or some very long period of time. A guy or a man or a woman who's working at a technology company cannot step out to go to a doctor's office and spend 2 hours waiting to be seen, because everybody knows that they're gone. Everybody's sitting in an open bullpen. They know when you leave, they know when you come back, and they know that you've done this 3 times in the week so far. So one of the things that we can do with the virtual care is, you know, somebody can go off to one of those telephone booths that they have in the startup environment. You can have a 30-minute discussion with your coach. People think you're having a business discussion, and you can go right back to your desk and nobody knows anything. So, you know, again, that's, I think, the way we deliver care at home or in the virtual work environment. I think that's another way to do it. And then finally, we were sort of getting at this at the beginning when we were talking about business model. Our focus right now is on being direct pay. And actually, we have many people who talk to us and say, I do not want these expenses going through my insurance, because you know, they're concerned about their privacy. They're concerned about what their insurance company will do with their data. So we actually have, you know, the core of our business right now is a direct pay. I mean, we do some out of network for people who have out of network benefits. And obviously, probably if we want to scale nationally, we probably have to have third-party relationships. But, you know, we think we can build a significant business just on the direct pay, because so much of it already is out of pocket. And again, is so much of that, you know, people paying directly is another way that they have control and can control their privacy and confidentiality.
Awesome. Thanks for that, JL. But given that, or do you still think that there are any particular or targeted partnerships that would help accelerate growth, although you're planning to still be direct to consumers and patients?
I mean, look, at the end of the day, you know, if you were to... every payer, when they look at their costs at the end of the year, they're going to see that there are a small number of key drivers of cost, right? Obviously, those things are going to be unexpected things like cancer diagnoses, right? Or a preterm baby. Those are things that are going to be huge drivers of cost. But I think one of the other ones is substance use. And actually, probably that's one of the largest causes of healthcare spend, whether acknowledged or unacknowledged, that payers end up paying for, whether you realize that somebody's at rehab or, they're missing work because they have a substance use problem. We think that that's a huge driver of cost. And I think if you're a major payer, if you're a United or an Aetna, you feel those costs. And I think that, for payers who are currently covering 28-day rehab and, seeing how much it costs and realizing how often those patients are going to go back, I think they're looking for alternatives. So probably one of the biggest areas that we've heard that payers are interested in, and employers, especially self-paid employers, is addiction support, addiction care services that can help reduce the cost of addiction care, but also reduce the costs associated with reduced productivity, absenteeism, all the things that happen with somebody who has a substance use disorder before they end up going to rehab.
Got it. Thank you for explaining that. So I know we have a few more minutes left. I want to kind of, before I open up to questions from the audience, for those who are tuning in live, if you have any questions for JL and Adam, please add them in the ask a question box or in the chat box, and I will make sure that those questions are addressed.
And actually, just wanted to get back to just the market size. So we went over that quickly. The estimates, SAMHSA estimates, are that there are 20 million people in the United States with substance use disorders. The vast majority of them are not being treated. So there's a large group of people who are not being treated. But despite the fact that we only treat probably about 10%, it's still a $30 billion market right now in terms of drug and alcohol treatment. So obviously large market. So large market with a lot of money that's misdirected and misspent, we think. And then more importantly, we think that there is a large community of people who are not being treated. There's a huge unmet need here, and we think that there's an opportunity there as well.
Thank you for explaining the market size. Can you tell me a bit about the user experience? So if I'm, I come on to Suntra's platform, how do you determine whether or not a patient needs a coach or needs, full on, needs detoxification or medication? What's that process like with pairing the patient to the appropriate provider?
It's most effective over a phone call. I think everybody wants to hear that it's going to be done through technology and whiz bang, but it just, again, people have to connect. People have to have a trust. Nobody is disclosing their drug use blindly through a chatbot without a level of trust. And I think that's important. So before treatment even starts, there's a relationship that has to begin and start being established. And that's still a good old fashioned phone call.
Makes a lot of sense and refreshing to hear, actually. Normally it's some algorithm.
Yeah, it's just people don't connect that way with something that they're ashamed of, and they would tend to lie in the beginning, and even in a personal conversation, a lot of times the truth doesn't come out until the second visit.
Awesome. That's great that that's the approach you all are taking. All right, so we're at the 2-minute mark, but I wanted to, I don't see any questions from our attendees yet, but wanted to give JL, give you and Adam an opportunity to just address or share anything else that you think would be helpful to those who are listening in and who will be watching later on.
Yeah, I mean, I just think that addiction is the biggest unmet or unsolved problem in healthcare now. And I think, there's still, Adam and I joke that the word stigma is overused, and, we believe that, but, there's still a lot of people who are not comfortable talking about addiction, but it's a problem that affects many, many people. Probably, there are people that who are dealing with an addiction problem that they probably haven't told you. And I think that, again, it's a huge driver of spend in healthcare, that if we could figure that out, I think we could save a lot of money and, be more efficient in how we allocate our healthcare dollars. But more importantly, if we can figure out how to better scale the treatment of addiction, which is for the most part, very much a mom and pop cottage industry, even in a place like New York. I think if you can be more efficient, you can help many people. And then there are lots of indirect benefits associated with that, right? Indirect benefits to families. Families stay together. Indirect benefits to employers. They get higher productivity out of their employees. So, addiction is the root cause, I think, of a lot of things that we see in our society, a lot of challenges that we see. And if we can develop, an approach, a national approach, we're not going to solve this problem by ourselves, but we think we can be important contributors. There are many, many benefits, economic and non-economic, that can be had as a result.
Thank you, JL. Any final words, Adam?
No, I'm going to leave it at that. I know we're under time here.
Awesome. Well, I want to thank you both for making time to share more about your backgrounds and share more about Suntra Modern Recovery. And we're looking forward to seeing your growth and progression over time. And we'll definitely have to have a follow-up conversation in a few months.
All right, Ashley. Well, thank you very much for the invite. We appreciate it.
Of course.
Yeah,
thank you both.
All right, then. See ya.
Bye.
Bye.